about returning back to normal, and that includes trips to the dentist's office. We're here at Riccobene Family Dentistry in Cary, and we're going to talk to Dr. Drew McNeil about the ways they're keeping patients and staff safe.
Before the appointment begins, we send out a pre-screening survey to patients. It's pretty much a survey of their exposure to COVID-19. Whether they have any symptoms, feverish, cold, cough. We still have another screening survey they fill out at check-in. Again, their temperature is taken. We check our staff temperature. Our staff undergo the same regimen that we ask our patients. And so we've really made sure that everything up until the point that a patient walks in the door, we've screened out and limited the potential risk to the appointment. Once they show up for the appointment, we follow all the standard protocols. We keep our 6 feet minimum distance. We limit the number of patients that are in the waiting room at any one time. We offer the patients the option of waiting in their car until their appointment time. So this is the area that we've sectioned off that we scrub our air with. There's a barrier here and a barrier on the other side. It contains the aerosols that are generated during the procedures. Those aerosols are then captured with a fan that goes through a series of HEPA filtration systems. After that, they are exhausted straight up through the roof of the building. So we're pulling fresh air in and exhausting clean air out.
I came in, I didn't originally have a mask, and I was greeted with them saying that the patients need to have a mask. So I went out and got my mask. I filled out some forms, then they asked to take my temperature, and they did it non-contact. You just lean over and they scan your forehead. When you come in, they have hand sanitizer stations that are 10 feet apart, so you can sanitize before you go back. The dental hygienist, Renee, came in. She had gloves on, she had her mask, she had eyeglasses, and I noticed also between every procedure, between the cleaning and then the buffing, she switched gloves. They had their keyboard covered, they had the screens were all covered. They all had isolation gowns on, which was really nice. I know it's super uncomfortable for the hygienists, but they're doing it to protect us, so that was just a nice feeling. There wasn't this sense of kind of chaos that you've been feeling walking around in grocery stores where everyone's on edge. It's almost relaxing. I know the dentist isn't ever really relaxing, but it was just nice just to know they greet you with such niceness and warmness, all while maintaining the social constructs of trying to stay safe and whatnot.
The measures we're taking follow all medical guidelines and exceed that in most cases. We practice universal precautions with every single patient. We love our patients, we love our patient base, and we're taking all the necessary precautions and steps to keep us safe as well as patients.